How do you fix a crossbite in an adult when the jaw is already fully grown? This certified oral surgeon shows you how it's done.
This patient is a 34-year-old male who originally went to his orthodontist with several concerns. He has a transverse discrepancy, otherwise known as a crossbite. He has a very steep, high-arched palate and limited arch space in his upper jaw. We need to create arch space in the maxilla by widening the palate. This is done by separating the suture in the middle of the palate. The treatment is called surgically assisted rapid palatal expansion, or SARPE. Once the patient is asleep and the airway is secured, I make an incision in the vestibule of the maxilla. I carry the incision from the left first bicuspid to the right first bicuspid, and then dissect through the mucosa, periosteum, and down to the bone. I elevate the nasal mucosa and then place a retractor to protect the nose. Next, I create osteotomies through the zygomatical maxillary buttress and the nasal maxillary buttress using a reciprocating saw. I separate the posterior maxilla from the pterygoids at the pterygomaxillary junction using curved chisels. Then I separate the base of the nasal septum from the maxillary crest using a septal osteotome. Now I use an oscillating saw to create the midline split. I start at the anterior nasal spine and work through the alveolar bone between the central incisors. I complete the majority of the cut with the saw, and then I use a narrow chisel to complete the osteotomy. Ready? I direct the chisel inferiorly to separate the bone between the central incisors. Then I direct the chisel posteriorly to separate the palate at the midline. Once everything is complete, I activate the appliance by turning it until there is approximately a 1 millimeter diastema between the central incisors. Here's what things look like after the expansion is complete. His palate is much wider, which also widened his nasal base, making breathing through the nose much easier. His crossbite is corrected. Now, the orthodontist takes over, straightens his teeth, and closes this gap using either braces or Invisalign.